In this video, we're going to be talking about Medicare prescription drug plans, how to choose them, and how they work. So Medicare makes a standard model that all the drug plans have to abide by. Now, they can offer coverage at least as good or better than the standard model. So the way this works is all drug plans in 2023 are going to have a $505 deductible. Now, some companies can choose to cover all or a portion of that deductible. Once you hit the 505 deductible, then you're going to basically pay copays or coinsurance until the total cost gets up to $4,660. Now, once you hit that threshold, that's when you enter into what's called the donut hole or the coverage gap. And that's when you pay 25% of brand and generic drugs once you're in that coverage gap. Now, if your total expense throughout the year, including what you've paid plus what the insurance company has paid, equals $7,400, that's when you enter into what's called the catastrophic coverage phase, where you're going to pay about 5% for brands once you're in that phase. So your drug cost gets reduced significantly once you enter that catastrophic coverage phase. Some terms to be aware of. Now, number one, Medicare doesn't cover all prescription drugs that are available. But there is something called a therapeutic equivalent. Like every plan does have to cover at least 2 therapeutic equivalents of every FDA-approved drug. So they try and make it so there is something similar available. Now, if you can't take another drug, the first step of what you could do is you can get a formulary exemption. This is basically the doctor sending in a form to the plan saying, hey, this patient needs this drug because of X, Y, and Z. Then the plan can prove the formulary exemption. Usually when the formulary exemption gets approved, the plan covers it in their highest drug tier. Another exception that you can get is called a tiering exception. So this is if you have a drug that is covered, but it's covered in a high tier, like let's say a tier 5 or a tier 4, where you're paying 50% of the cost of the medication. You can apply for a tiering exemption, which is going to lower that drug cost by reducing the covered drug tier that it's in. And one other thing to obviously pay attention to is these plans can have different drug formularies. So not all plans are going to cover all the drugs the same. So an easy way you can view all the plans is simply on Medicare.gov. They have a comparison tool where you can pull up all the drug plans. It'll sort the plans based on affordability, based on 3 variables. Number one, the cost of the plan, the cost of the drugs at the pharmacy, and your preferred pharmacy. So if this video is helpful, you like learning more about Medicare, hit the subscribe button. We'll talk to you soon.